Hi, everyone. Let me go through the questions, answers, and rationale for the practice exam. Um, so you can get a sense of how this is going to work. This is also how I go through all the exams. Okay, so the first question has to do with Heinz's dilemma. You'll notice, see if this works. It's worth 2 points, and that's because there's a point for the correct choice, A, B, C, or D, and there's a point for the rationale as well. So some questions are worth 2 points, some are worth 1 point. Heinz's dilemma highlights an important ethical conflict. What is one example in which this conflict is presented in the case? So the primary ethical issue in Heinz's dilemma is the relationship, the tension between intention and action. As we all know, Heinz had a good intention, but he acted poorly by breaking into the store to steal the drug. And so that relates to letter D. Heinz wanted to help his wife, but he had to break the law to do so. And so that needs to be put in here. And in fact, intention versus action needs to be in the rationale somewhere as well. It doesn't matter how it's worded, but it just needs to be in there because that was highlighted a number of times. Okay, question 2. How does the notion of the white coat syndrome best connect to wit? Worth 1 point. White coat syndrome is really the deference that patients or the general public give to clinicians, especially physicians. That white coat enables trust, even without knowing and having a relationship. And so that is most aptly connected to letter C. Very start of wit, Vivian signs the informed consent form immediately after receiving her diagnosis. Now, granted, she was probably in shock for sure, but she was also sitting across or talking to her oncologist, who was essentially saying, listen, you have advanced ovarian cancer. There's a drug that we think might be able to help. It's part of our research. We want you to consider this. There was trust immediately. Number 3, 2 points. This is the Jerry Johnson clinician who works at the local hospital who talks to the concerned neighbor, Mrs. Todd, in the grocery store about the young boy's injury. What is the ethical conflict associated with this encounter? So it's true that Jerry violated HIPAA, shouldn't have said anything in terms of confidentiality and privacy. That's a violation. That's a true statement. But the conflict that we discussed is sharing confidential information versus his relationship with a concerned neighbor. That's really the true conflict that he encountered. Now, the reality is he shouldn't have violated the confidentiality and privacy. But the real conflict, especially for Jerry, lies with the relationship and sharing the confidential information. And so, as I described, in each exam, there'll be a film clip because we're watching documentaries and films. What's the primary connection made in relation to Vivian's personhood? This film clip has to do, it's the isolation scene. And so it really is connected to Vivian's cancerous experience in isolation. So the scene, which is about a minute long, and she talks to us, where she says she's alone and not much happens. And of course, the scene in the room is very bare, very cold. And that's really connected to how her personhood has evolved since the cancer. So that needs to be in here, whether it be a description of the room, whether it be what she's feeling while she's in the room, it needs to be in there. Okay, so this is how the rationale is going to work. I'll just be doing these through these recordings. You can watch it as many times as you'd like. Thanks very much, everyone. Bye.